I'm Dr. Jyothishmathi from Sri Raghavendra Fertility Center, Mailadivpalli. In today's video, we are going to discuss about uterine polyps. What are uterine polyps? Uterine polyps are small structures found within the inner layer of the uterus called the endometrium. Now, the normal endometrium is like a carpet which lines the inner lining of the uterus. If there are some projections, like if the lining of the uterus becomes folded upon itself, it usually results in a polyp. There are some conditions in which women are more predisposed to the development of such polyps. The problem with the polyps is that they interfere with the process of implantation, that is, the sticking of the embryo to the lining of the uterus. So, polyp, no matter whatever is its size, is usually considered as a hindrance to the pregnancy, and identification of any polyp is usually advised to undergo a polypectomy. Symptom wise, a lady may have symptoms such as heavy bleeding, painful bleeding when they have polyps, especially when they have more number of polyps. It is more commonly identified when the lady undergoes an ultrasound scan, wherein these polyps are seen as bright, rounded structures seen within the inner layer of the uterus. Now, it is much easier to identify the polyps on a 3D scan compared to a regular scan. Once the polyps are identified, then the removal of polyps is done through a procedure called hysteroscopic polypectomy. In this procedure, an instrument which has a long light source and a camera is introduced into the uterus. There are usually no cuts or any surgeries, any scars over the abdomen, because the whole procedure is done via a long scope introduced from below to the lady. Now, in this process, along with the hysteroscope, a few other additional instruments are introduced into the uterus and the polyps are caught hold of and removed, and this is followed by a gentle curettage of the inner lining of the uterus. And the tissue which is thus obtained is sent for histopathology to confirm that the polyp is of benign nature. Once the polyps are removed, then the chances of the couple to get pregnant are much higher, and it is to be kept in mind that these polyps do recur sometimes in some women. That is, even if they are removed in one cycle, they might reappear after a few number of cycles. So, once the polyp removal or polypectomy is done, it would be better if the couple would try to get pregnant. The sooner the better. Thank you.